Hi, my name is Allie. I'm a physical therapist who specializes in the TMJ and myofunctional therapy. Today I'm going to show you how to release tension behind the jaw. There are two big muscles that run behind here. They're called the stylohyoid and the digastrics. And they run right back here behind the jaw. And a lot of patients who have TMJ dysfunction have tension in these muscles. So what you're going to do is you're going to place your fingers back behind the jaw, right underneath or in the crease between the ear lobe and the jawbone. And you're going to take those fingers and apply a therapeutic amount of pressure. This is challenging because it's very individualized. I say with pressure, you shouldn't go above a 3 out of 10 discomfort. So you want to keep it minimal. We want to create safety in these muscles and not just ream on them and apply so much pressure that it hurts so much. That is one way to release tension, but I find it's easier and better on the body if we use a gentle, more soft approach on places that are painful. So we're going to take our fingers and run back behind the jawbone and come right around that angle of the mandible and just keep coming, following the line of the jaw. So again, we come up here, right behind the jawbone, press down, and you can stop and hold if you find any discomfort in there. Stop and hold a little bit and come on down that way. You can do this a couple times a day depending on how sore they are. Once a day might be enough, but maybe a couple of times a day if this is a really sore spot on you, because any tightness in the body is going to make the jaw and the jaw bones and the cranium bones become a little bit torqued and misaligned. And we're talking really tiny motions, but if anything in the body is tight, it's pulling things out of alignment, which can then affect all the rest of the muscles and the joints around that area. So by releasing this tension, we might be able to reduce some pain or tenderness around the jaw joint itself.